Good morning, everyone. This is Dr. Mike, and we're here for day 4 of our 30-day challenge, how to make your medical exercise training practice referral ready in 30 days. Now, this is day number 4, and today we're going to talk about the idea of how to list your services clearly. This means listing the services clearly so the medical professional can understand the services you're offering. Now, folks, there is a bit of a communication gap between the fitness industry and the healthcare industry. The fitness industry looks at things more from a general perspective, where the medical industry or the healthcare industry looks at things from a very specific perspective. Generalizations in the fitness industry could include exercise to improve function, exercise to improve health. Whereas on the medical side, we look at exercise as being part of the treatment process. And with that exercise, we need to be able to tell if it's safe and effective and then be able to measure the improvement. So, with that, as you start to list your services or your menu of services, you want to make sure that you're able to clearly and succinctly convey to the medical community your services are safe, they're effective, and they're manageable. So that's what we're going to talk about over the next several minutes. So with that, we mentioned a couple of times before with this physician's referral challenge, for you, the medical exercise professional, we realize that there is some information out there, and there are some guidelines and protocols and procedures you may not be up to speed on. So with that, we've also developed a number of manuals. We have our Cracking the Code manual, which is the ultimate guide for insurance reimbursement for the medical exercise specialist. You can actually purchase this as part of our Physician's Challenge bundle, or you can purchase or along with that, I should say, you could purchase our Advanced Medical Exercise Specialist manual. Now, these two manuals together give you procedures, guidelines, protocols, templates, letters, forms that you'll need to now connect with the medical community, establish referral relationships, and be able to follow up on those referral relationships. Now, we're offering a special price, $199, as part of our seminar series that goes along with this 30-day challenge. So please go over to crackingthecode.net. Purchase your manuals. You'll be able to download them immediately. We also have a number of multimedia links that are in the manuals that will help you with things such as your assessment procedures, range of motion, goniometric measurements, and things of that nature. So please take advantage of that as part of our webinar series. Now, let's talk more about listing your services clearly. Now, in the chat, I've downloaded or allowed you to download a number of documents. There are actually 2 documents there. One is a list, how to list your services clearly. It's a step-by-step procedure going through the items we're going to talk about. And the second one that you'll find there is another document that allows you to actually write out what you'll include in your menu of services. So you're going to have a medical exercise training menu of services. So list your services clearly. What you're essentially doing is putting together a menu of medical exercise training services. Now, before we start, we always do this in all of our courses, is talk about the scope of practice. We're talking about managing medical conditions with exercise. No treatment, no therapy, and we're not trying to take the place of the therapist. So your role in scope of practice as a medical exercise specialist is to provide medical exercise training or MET assessments. This is a must. You must assess the new client to determine what their functional deficits are, what they can and cannot do. And that allows you now to establish goals, short-term and long-term goals, as well as deciding what functional outcome measures or FOMs that you'll use to report to the doctor, therapist, or chiropractor the client's progress. These functional outcome measures include blood pressure, heart rate, strength levels, range of motion levels that are universally understood by both healthcare professionals and fitness professionals. And it allows you now to communicate more effectively with the medical community to show how effective your exercise programs are being applied so that the client is getting better. Also, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, which I've said over and over is going to become a much bigger component of your scope of practice over the next 20 years with the aging of our continent, aquatic training, and stabilization training. Now, with that, let's talk about this MET services menu checklist. So please, I'll put these in the chat. If you're watching this video afterward, please go down below. You should find a link there where you can actually download these items, the checklist, as well as the other documents we've provided. So first thing we're going to look at is the idea of a practice overview. So what I'm going to do here, if you don't mind, we've given you an example of a medical exercise services menu. So what I'm going to do is just simply read through that. So you'll notice we talk about the practice overview, and this is how it's noted in the document we've provided. I provide medically based, structured exercise programs to help clients transition safely and effectively from physical therapy or medical treatment to full independent function. My focus is on managing chronic and post rehab conditions through exercise, promoting long term mobility, strength, and quality of life. Now, folks, to the medical professional, physical therapist, chiropractor, physician, they understand that very clearly and very succinctly. Is written from a perspective of how a medical professional or healthcare professional would understand exercise being provided to their patient after therapy services are done. It clearly notes there's no therapy being done. It clearly notes the idea is to provide safe and effective exercise, and the idea is to promote long-term mobility, strength, and quality of life. So when we look at this overview, practice overview, you want to include that at the top of your menu of services. Now, this menu of services is a one-page document that you're going to share with doctors, therapists, chiropractors, clients. You're going to put it on your website, as well as you're going to have a print version of it that when you do go to a doctor's office or you do communicate with them in any form in person, you're going to make sure they get a copy of that menu of services. That way they know exactly what services you're offering. And the way you're going to now word this and lay it out is such that the medical professional can understand it. Physical therapist, chiropractor, nurse, orthopedic surgeon, neurologist, whomever it is, they understand exactly how exercise can now help improve their clients or their patients' level of function. Next on the list, commonly or conditions that you commonly manage or have managed. Now, this becomes important because for the medical professional, they're not exactly sure what patients should get exercise. So you want to make sure that you give them a clear list of the conditions that you commonly have managed to improve their level of function. So if you do a lot with neurologic clients, then you would list Parkinson's, MS, multiple sclerosis. If you've done a lot with total joint replacements, total hips, total knees, total shoulders. If you work a lot with spinal clients, you will list those clients that have had spinal surgeries, such as fusions or laminectomies, or maybe they have soft tissue injuries that haven't involved surgery, such as disc herniations or degenerative joint disease. So what you want to do is include a bulleted list of the conditions that you've managed to successful outcomes. And notice what I've said, where you've managed them to successful outcomes, which means you have the skill, the knowledge, and the necessary training to work with these clients. You're not shooting in the dark, but you're giving this menu of services to your client as well as to medical professionals. You need to be able to deliver on the services and the conditions that you say you work with. Next on the list, the services provided. Now, this becomes important that you want to note the services provided. So you can notice this on our document, but if you would please, I'm going to note these here in the presentation. Medical exercise services offered include post-therapy exercise progression. This means safe and progressive exercise following discharge from physical therapy or occupational therapy. Next, functional strength and endurance training. Restores strength and stamina needed for daily activities. Next, balance and gait retraining. Reduces fall risk and improves confidence in movement. Next, neuromuscular reeducation. Improves motor control in neurologic and orthopedic conditions. Next, postural realignment and core conditioning. This supports spine health and joint integrity. Next, ADL conditioning. Enhances ability to perform activities of daily living. And the last one on our list is medical fitness maintenance plans. Long-term programming to manage chronic disease and prevent regression. Now, folks, that last one, the medical fitness maintenance plans, put an asterisk beside that one. That is going to become a bigger component of your practice over the next 20 years as we deal with the aging of our population here in North America, but also around the world. So you want to make sure you list the services that you provide or the services provided so the medical professional has a clear understanding of what you're doing. Just simply saying functional conditioning or strength training, give it a little bit more of a clearer definition so that there's no ambiguity and the medical professional or healthcare professional knows what they're referring for. Next, your assessment and progression process. This becomes important because the medical professional wants to make sure that the assessment you do, and let me say this, make sure an assessment is done and make sure that that assessment truly gets an idea of what's going on with their patient, your client, and then develops a plan with short-term and long-term goals and an effective plan that's safe and effective to get them to a higher level of function. So, an example, all clients receive a comprehensive functional assessment, including medical and physical history review, functional outcome measures, such as things like gait speed, sit to stand balance testing, and also a risk screening and exercise readiness to see if the client is appropriate for exercise. So this becomes important because not every client, even if they have a medical condition, is appropriate for exercise. And the medical professional, the physician, the therapist, the chiropractor want to make sure you're not just taking everybody in and starting them on an exercise program, but you're doing your due diligence, as a professional to make sure they're appropriate. Next, the expected outcomes. Now, this is kind of an interesting component. Medical professionals do want to know what you're going to do for their clients. With that, some of the expected outcomes include improved gait speed and balance, increased joint range of motion and strength, reduced fall risk, enhanced ADLs or independence with ADLs, and return to work, hobbies, or sports in a safe manner. Those are some of the expected outcomes. List those on your menu of services. And with that, the last thing is to include contact and referral information. Now, this menu of services should be at max 1 page. Now, it could be front and back, but I would advise probably the front because not too many people turn over a document. So with that, make sure you include your contact information. That includes the following. Make sure you include your name, your credentials, a phone number, a secure email address, and if you have a fax number, make sure you include the fax. Folks, doctors, therapists, and chiropractors, regardless of how progressive they are, we're still using the fax as a HIPAA-compliant means of communicating with other healthcare providers in a safe manner and a secure manner, and also include your location. Note also if you see clients in a studio setting, or if you go to clients' homes. It's interesting, folks. I spoke at the American Academy of Orthopedic Surgeons meeting several years ago, and it was interesting. Most of the medical providers want you to be able to go to clients' homes because most of their senior clients are at home. They've received home services and they want them to become more independent at home and the ability to get out of their home and become mobile in their communities. Now, if you do have a studio listed, of course, but also, if I were a medical exercise professional trying to get more referrals, I let doctors, therapists, and chiropractors know I do go to clients' homes when necessary with the idea of getting them strong enough and functional enough that they can now come to the studio. Please make sure you include your contact information and also how they can refer. Tell the doctor or note there on the menu of services at the bottom, contact us if you have a referral. Or one thing you may want to do is have referral pads made up that you drop off along with the menu of services. So they have a referral form they can fill out right there, give it to the client or give it to their front desk person, and they can contact you. So you can see when you start looking at this menu of services, this becomes a very succinct, to the point, but clear-cut one-page document. And we'll say 1 page front and back. 1 page document that now allows the medical professional to understand who you are, what you do, how you do it, and who you do it to. You remember we talked about that in the elevator speech section. The only thing we're doing now is putting it down on paper. Now, please, if you would, make sure if you're watching this video, you look down below to download the documents I've talked about. They will be very helpful. We have a template that allows you to type in your information so that now you can have your MET menu of services, and it will help. With that, please make sure, again, you download the copy that's below. And this is all sponsored by our Medical Exercise Specialist Network. The network will relaunch on May 22nd. You'll get an email from us inviting you to join our network. Now, we will have a free level that all medical professionals from around the world can join. We also will have paid levels where you can get more information on how to build a successful and profitable practice and improve your skill set to produce better outcomes for clients. Again, this is our Cracking the Code webinar series for medical exercise professionals, or what we call MedX Pros. Please go over to crackingthecode.net to get more information and to see previous recordings. And we thank you for taking the time to watch this video. If you have questions for me, please email me at drmike@postrehab.com, and make sure you look down below to download those additional documents we have to help you build a effective, for lack of a better phrase, effective menu of services that you can now market your services with. All the best. Take care.